most times if you spend the whole time listening to all the patient info and blah blah blah, and at the end of the day, you might end up missing.
পারপাস কি দিছস বাইরে যাওয়ার জন্য না আদার্স?
As we're going to start in about 15 minutes, just give it a second again. Alright guys, so good morning. Let's talk about the day we're doing today. A lot of it is about the abdomen, okay? This day is mainly about the abdomen. Right? And we're just going to be doing the abdominal scenarios, right? There's different kinds of abdominal scenarios. There's one where you do an actual human being. There's some that you do on an actual human being, and these are the ones right here. Diarrhea in a young woman, diarrhea in a 40-year-old woman, diarrhea in this abdominal pain, the appendicitis, peritonitis. And then there's the acute abdomen on the abdominal trainer. Yeah, and for these ones, obviously, you put them right here. Okay. Huh? Yeah. Who's the sniffling on my teeth? Who's sniffling? Stop sniffling. Alright, so mute your mics, everybody. Okay, so okay. So TMC are unlikely. If they start bringing things back, they bring it back slowly. Okay, so we're gonna cover some of these, but you just need the scenarios really. Okay, you just need to know what the scenarios are. Okay, and then we might watch a couple. Yeah, we might watch the examination, for example, and a couple of them. Okay, just to get you into the know-how. Yeah. Okay, so without further ado, okay, so guys, no recording. Okay, I'll play this twice for you. Yeah.
Okay, so let's have a look on how would you perform abdominal examination on this mannequin. Okay, so you tell the patient, okay, I need to examine it now. That's okay with you. Good. Just gonna look at your tummy, look over the sides of the look. You take a deep breath in and out from this. Any pain anywhere in your tummy? No. Bring it down a little bit and you feel for superficial palpation. Okay, good. Obviously, you start with your deeper now, and then now you palpate. Up. For any muscles, for any. Okay, good. So superficial deep palpation. We're going to check for the liver now. Okay, if you can take a deep breath in and out, and the patient, when you ask to take a deep breath in and out, patient will move this, and you see the liver with the moving like that. Okay, you see the abdomen is moving with respiration. We'll move it like that. Okay, so take deep breath in and out. I'm using the board of my hands, of my fingers, starting from the right leg fossa. Deep breath in and out. Okay, show that again. Deep breath in and out. So in this case, the liver is very enlarged. You can feel the liver here. Okay, it's about 3 fingers below the costal margin. So you assess the liver according to the number of fingers below the costal margin. If you want to assess for the spleen, same start from the right leg fossa. Take a deep breath in using your borders like this. Deep breath in and out. Okay, and you can ask the patient to lie on the left. Can you just lie on the right for me, please? It brings the spleen closer. You take deep breath in and out. Okay, you do that. Good. Now, palpation of the spleen. Put your hand in like this. See, you're gonna put it down here and one on top. So after them, take a deep breath in and out. When you deep breath in, out, the kidneys will come down. So take a deep breath in, out, in, and then you palpate when you breathe in, like that. Okay. You come on this side, you do the same thing. Take a deep breath in, take a deep breath in, and then you ballot the kidneys. So try to ballot the kidneys like that. Okay. When you breathe out, the kidney comes a little bit closer, and you try to ballot. Good. What else we need to check? We need to check for rebound tenderness. So for example, the patient has got a pain in the right leg fossa. We want to check for rebound tenderness. So you can have to press and then ask the patient which one is more painful. Is it when you press or when you release? Okay. So please bear with me. Press on your tummy. Just let it know which one is more painful. Is it when I press or when I take off my hand? Okay, so just gonna press gently. When I press and then I take off. Which one is more painful? When I press or when I release my hand? When you release. So if it's more painful when you release your hand, that is a rebound tenderness. I'm gonna be tapping as well. Tell me if that hurts. Does this hurt as well? Okay, if there is pain on percussion, that is what? Percussion tenderness. So rebound tenderness, percussion tenderness are the signs of peritonitis. Signs of peritonitis. We did demonstrate already palpating for aneurysm, umbilicus above it. Okay, you palpate for aorta like that. If you suspect aneurysm, you start a little bit further away, then you move closer, and you move closer, and you move closer. It will proceed in that way. Okay, good, excellent. So you're done inspection, you're done superficial, deep palpation, then you're gonna go to percussion. Percussion for the liver, same, we're gonna start from here. We do it again. So it's a change there, so somewhere from there, and then you continue. It's a change there, okay? So you can find roughly in centimeters how big the liver is, okay? Then you have to check as well for flank downwards and shifting downwards. So this umbilicus, what you're gonna do from here, finger straight, make sure your wrist bounces, moves that. So if you found the downwards in here, you ask the patient to lie on one side and you wait for the fluid to sink down, and once the fluid sinks down a little bit, you percuss again. Initially we found the downwards in here, and once the patient lies this down, there's no longer downwards. So the downwards has shifted. That's called shifting downwards. Okay? So ask the patient to lie back again. Good. So that's percussion. If you're suspecting that the bladder is enlarged, you can palpate during palpation. Okay? Palpate for the bladder. Yeah, during palpation, you're gonna feel the bladder there. But you can also percuss. Then move down. So you can find the downwards in percussion or suprapubic area. And on palpation, which you should do under palpation, you may find an enlarged bladder here, which we already did demonstrate. Okay? On how to find an enlarged bladder. Good. Auscultation. Said for the aorta, auscultate above the umbilicus. Above the umbilicus, the same position we auscultate, we listen. Then for the renal broad, there, renal broad, there. For bowel sounds, you can listen all the way, really centrally. Okay, good. So this is how you will be performed. So you'll be really, a little bit more quick in doing it. So don't waste time. Let's recap again. Don't waste time. You come and have a look. Okay, any pain anywhere in your tummy? No. Okay, you touch it gently. Okay, your tummy is softy. No any pain anywhere? No. Okay, then you go to deep palpation. Okay, any muscles, it's a deep palpation. Any muscles, deep palpation. Okay, liver and spleen, deep breath in and out, in and out, in and out, in and out. Good. Good. For the spleen, we do the same. For the kidneys, take a deep breath in. The moment the patient breathes in, you try to pollute the kidneys. One hand here, try to pollute the kidneys. And you do the same here as well. Deep breath in, you try to pollute the kidneys. Okay, good. Percussion, as we said, you're going to have to, the other palpation, rebound tenderness, is it more painful in press or when you release? Okay, aneurysm, you go like that. Good. If you suspect aneurysm, start from peripheral, moving closer, just palpate for the aorta, just palpate it on top, and that will be done like that. Good. Percussion, you percuss for the liver, okay, you percuss for flank downwards as well at the same time. So just move quicker, it's a quick examination. Okay, good. Now let's look about the special tests. What's special test? First is Murphy sign. So Murphy sign, okay, we're going to demonstrate the Murphy sign shortly.
Alright, guys. So, you need anything repeated? One more time? Because some people just came, yeah? Okay, I'll play one more time. Okay, we got time. Sorry, we got time. 3, 2, 1, go.
Okay, so let's have a look at how did the perform during examination this morning. Okay, so the two of the patient, okay, I need to examine now. Associate here, good. Just going to look at your tummy, you go to the sides, look. You take a deep breath in and out, please. And pain anywhere in your tummy, bend down a little bit, and you feel for superficial elevation. Okay, good. Our protection is starting to deeper now. And now we go bit. Yeah. Muscles. Good. So superficial deep compression. Check for the liver now. Okay. If you can take deep breath in and out, and the patient, when you ask to take deep breath in and out, patient will move this, and you see the liver will be moving like that. Okay. You see the abdomen is moving with respiration. You will move it like that. Okay. So take deep breath in and out. I'm using the board of my hands and my fingers, starting from the right leg fossa. Deep breath in and out. Okay, show that again, deep breath in and out. So in this case, the liver is very enlarged. You can feel the liver here. Okay, it's about 3 fingers below the costal margin. So you assess the liver according to the number of fingers below the costal margin. If you want to assess for the spleen, same is start from the right leg fossa. Take a deep breath in using your body as like this. Deep breath in and out. Okay, and you can ask the patient to lie on the left. Can you just lie on the right for me, please? And bring the spleen closer. And take deep breath down. Okay, keep the rotation. Good. Now, palpation of the spleen. Put your hand here like this. See, you're gonna put it down here, and one on top. So after then, take a deep breath in and out. When you deep breath in, out, the kidneys will come down. So take a deep breath in, out, and in, and then you palpate when you breathe in, like that. Okay? You come on this side, you do the same. Take a deep breath in, take a deep breath in, and then you ballot the kidneys. You try to ballot the kidneys out. Okay? When you breathe out, the kidney comes a little bit closer, and you try to ballot. Good. What else we need to check? We need to check for rebound tenderness. So, for example, if the patient has got a pain in the right leg fossa, we want to check for rebound tenderness. So, you're going to have to press and then ask the patient which one is more painful. Is it when you press or when you release? Okay? So, please bear with me. I'm going to be pressing on your tummy. I know it is painful. Just let me know which one is more painful. Is it when I press or when I take off my hand? Okay? So, just going to press gently. So, here I press and I take off. Which one is more painful? When I pressed or when I release my hand? When you release. So if you more painful when you release your hand, that is a rebound tenderness. I'm going to be tapping as well. Tell me if that hurts. Does this hurt as well? Okay. If there is pain on the percussion, that is what? Percussion tenderness. So rebound tenderness, percussion tenderness are the signs of peritonitis. Signs of peritonitis. We did demonstrate already, palpating for aneurysm, umbilicus, above it. Okay, you palpate for aorta like that. If you suspect aneurysm, you start a little bit further away, then you move closer, and you move closer, and you move closer. It will pulsate in that way. Okay, good, excellent. So we're done inspection, we're done superficial, deep palpation, then we're gonna go to percussion. percussion for the liver. Same, we're going to start from here. We do it again. There is a change there. So someone from there, and then you continue. There's a change there. Okay. So you can find roughly in centimeters how big this the liver is. Okay. Then you have to check as well for flank downwards and shifting downwards. So this umbilicus, what you're going to do from here, finger straight, make sure your wrist bounces, moves like that. So if you found the downwards in here, you ask the patient to lie on one side and you wait for the fluid to sink down. And once the fluid sinks down a little bit, you percuss again. Initially, we found the downwards in here, and once the patient lies this down, there's no longer downwards. So the downwards has shifted. That's called shifting downwards. Okay? So ask the patient to lie back again. Good. So that's percussion. If you're suspecting that the bladder is enlarged, you can palpate during palpation. Okay? Palpate for the bladder. Yeah, during palpation, you're going to feel the bladder there. But you can also percuss. Down, so you can find the downwards of the percussion of suprapubic area. And on palpation, what you should do under palpation, you may find an enlarged bladder in here, which we already did it demonstrate. Okay, on how to find an enlarged bladder. Good. Auscultation. We said for the aorta, auscultate above the umbilicus. Above the umbilicus, the same position we auscultate, we listen, then renal brewery, there, renal brewery, there. For bowel sounds, you can listen anywhere, really, centrally. Okay, good. So this is how you will be performed. So you'll be really, a little bit more quick when doing it. So don't waste time. Let's recap again. Don't waste time. You come and have a look. Okay, any pain anywhere in your tummy? No. Okay, you touch it gently. Okay, your tummy is softy. No any pain anywhere? No. Okay? Then you go to deep palpation. Okay? In muscles, deep palpation. In muscles, deep palpation. Okay? Liver and spleen, deep breath in and out. In and out. In and out. In and out. Good. Good. For the spleen, we do the same. For the kidneys, take a deep breath. Deep breath in. The moment the patient breathes in, try to pollute the kidneys. One hand in, one hand in. Try to pollute the kidneys, and you do the same here as well. Deep breath in, you try to pollute the kidneys. Okay, good. Percussion, as we said, you're going to have to. The other palpation, rebound tenderness. Is it more painful first or when you release? Okay, aneurysm, go like that. Good. If you suspect aneurysm, start from peripheral, moving closer. Just palpate for the aorta, just palpate it on top, and that will be done like that. Good. Percussion, we percuss for the liver, okay? We percuss for flank downwards as well at the same time. So just move quicker, it's a quickie examination. Okay, good. Now let's look about the special tests. What special test? First is Murphy sign. So Murphy sign, okay, we're going to demonstrate the Murphy sign shortly.
So, that's the abdominal examination. Let's check out some aneurysms, enlarged bladder, liver, the Murphy sign, how to look for it, Rovsing sign, how to look for it as well, yeah?
Okay, so let's have a look at the abdominal pathologies. Okay, what we have in here, we have abdominal trailer. Abdominal trailer has got different pathologies that we need to be aware of. Okay, let's come close and have a look at this. Okay. So first of all, we can place different organs. And what is obvious here, I want to show you the aorta. This is the aorta in this mannequin. Okay, it actually does pulsate. Okay, so if we do that, if you have a look for me, come close and have a look. You see that the aorta is pulsating on the side. Okay, it's pulsating on the side. Okay, so when you're palpating from the top of the abdomen, you'll be able to feel the aorta pulsating. The difference between an aortic aneurysm and normal aneurysm will pulsate up and down. Okay, it will pulsate up and down the normal aneurysm, but this one, the normal aorta will pulsate up and down. This one is pulsating to the side. You can look, it's pulsating on the side. Okay, it's not moving up and down, it's to the side, and that's the difference. Okay.
See.
That's the abdominal sounds it's going to make the microphone, the abdominal mannequin sound as well, okay? So let's take a look at the enlarged bladder. Okay, it's simple.
Okay, so the next is we're going to be looking at now is the enlarged bladder. So enlarged bladder for urinary retention. So what we are seeing in here, this will represent enlarged bladder. So I'm going to press in here. Okay, and when you will be palpating, close the abdomen. Close the abdomen. When you'll be palpating, you'll be able to palpate a mass which is the enlarged bladder on here. Okay, so these are the pathologies. So try and see where this is enlarged bladder. All the pathologies are there as usual. Thank you.
So, Murphy's.
Okay, so let's demonstrate the Murphy sign. So what is Murphy sign? Murphy sign, you press with the fingers in the right upper quadrant if there is pain. Okay, so you're gonna use these fingers and you're gonna press like that. Okay, press like that. You have to be gentle, of course. So you ask the patient to take a deep breath in, and whilst he's breathing in, you're gonna press in here. So, okay, can you just take a deep breath in for me, please? Oh, the patient will stop breathing. It will terminate the inspiration. So again, make your fingers ready, right upper quadrant. Can you take a deep breath in for me, please? Okay, so that is a Murphy sign. Good.
Okay, Rovsing.
Okay, so the next we demonstrate is Rovsing sign. Okay, Rovsing sign is for appendicitis. Yeah, so the pain in appendicitis is usually here in the right leg fossa. But what happens is when you palpate in here, you palpate like this, especially if you do some movement of this style. Okay, you're pressing in here. Usually, you press in such a way that you're pushing towards this side. When you press in here, the patient, instead of experiencing pain here, is experiencing pain on this side. So this movement of pressing. Okay, that's the Rovsing sign. You're pressing on the left leg of fossa, like that, movement like this, a little bit moving toward the side, pressing like that. Instead of experiencing pain here, where you're pressing, it's experiencing it here. That's the Rovsing sign, a sign of appendicitis.
Alright. Any questions? So for now, we take that into consideration and we go into our abdominal scenario, extension, abdominal trainer scenario. Okay?
Abdominal trainer.